Welcome to The Explainer. Today, we are diving into two absolutely critical calculations in emergency medicine. We're talking burn assessment and fluid resuscitation. When someone's life is hanging in the balance, getting these numbers right is, well, hits everything. So let's get right into it. Okay, picture this. The ER doors fly open. A patient is rushed in, severe burns. The clock is already ticking, loud. Your very first move isn't a guess. It's not an estimate. It's a precise calculation, and it's one that can literally change the entire outcome. To make this super clear, we're going to walk through a case study together. We've got a 100-kilogram patient with partial thickness burns. Now, this is a really common and incredibly tough scenario to face. Our job is to figure out how to handle it using two fundamental, life-saving tools.
Look, before you can treat anything, you have to assess the damage, right? So the first critical question is always this: what percentage of the body has actually been burned? And the go-to tool for that, the one you need to know in your sleep, is the rule of nines.
You know, the real power of the rule of nines is just how simple and fast it is. It's a standardized way to estimate what we call the total body surface area, or TBSA for short, that's been affected. It basically creates a common language so that everyone on the medical team is on the exact same page, instantly.
So here's how it works. The method breaks up the adult body into sections of 9%, or multiples of that. So for example, an entire arm is 9%. A full leg, that's 18%. The entire back is also 18%. For the case we're working on, we really need to focus on the numbers for the legs and the perineum.
Okay, so let's get back to our patient. The chart says they have partial thickness burns to the anterior, that's the front, of both legs, plus the perineum. So the big question is, how do we turn those words into a hard number? Let's break it down. It's pretty straightforward. According to the rule of nines, the whole front of one leg is 9%. Since our patient's burns cover the front of both legs, that's just 9% plus another 9%. That gives us our first number, 18%. Easy enough. Then we add in the perineum, which is always given a value of 1%. And there we have it. We add those two numbers together, and we get our answer. The total body surface area affected is 19%. And let me tell you, this single number is the key that unlocks everything else we need to do. So, with our assessment done, we now have that critical piece of the puzzle, 19% TBSA. That's the data we need to plan the treatment. We're officially shifting gears from figuring out what's wrong to figuring out what we're going to do about it. And that brings us to our second essential tool. To map out the patient's fluid resuscitation, and this is so important for preventing them from going into life-threatening burn shock, we use something called the Parkland formula. The Parkland formula is, no exaggeration, a lifesaver. It lets us calculate the precise amount of IV fluid the patient needs over the next 24 hours. This is what counteracts the massive fluid loss that leads to burn shock. The fluid we usually use is lactated ringers, mainly because it's very similar to the fluid our body is losing. And here's the formula itself. It's actually pretty elegant. It's just 4 milliliters multiplied by the patient's weight in kilograms times that TBSA percentage that we just figured out. All right, so let's plug in the numbers for our patient. We know the constant is 4 milliliters. We know our patient's weight is 100 kilograms. And thanks to that quick rule of nines calculation, we know the TBSA is 19%. We have everything we need. So now we just do the math. 4 milliliters times 100 kilograms times 19 gives us a grand total of 7,600 milliliters.
That's our target, 7,600 milliliters of lactated ringers. But here's the really critical part. It's not just about the total amount of fluid. The timing of when you give this fluid is just as important, maybe even more so.
The schedule is broken down into two very distinct phases. The first half of that total, so 3,800 milliliters for our patient, has to be given over the first 8 hours from the time of the burn. The second half, the other 3,800 milliliters, is then given over the next 16 hours. This aggressive front loading is absolutely essential to get the patient stable. So let's just zoom out for a second. We've just walked through two seemingly simple formulas. But the accuracy of these calculations, it has a direct, profound impact on a patient's chance of survival. There is just zero room for error here. So here's the whole process in 3 simple steps. First, you assess the damage with the rule of nines to get your TBSA percentage. Second, you plug that number into the Parkland formula to get your total fluid. And third, you administer half of that fluid in the first 8 hours. It's assessment, calculation, and then action.
I mean, this quote really says it all, doesn't it? These aren't just abstract exercises from a textbook. In the chaotic, high-pressure world of emergency care, mastering this fundamental math is an absolutely non-negotiable, life-saving skill. And that's really the question we're left with, isn't it? It's a powerful reminder that behind every single protocol and formula, there's a human life. And having this knowledge locked